All right, we are back. We hope you enjoyed that little 16-second clip. I haven't seen it. I'm looking forward to seeing it when I get to go to YouTube to have the post. Josh, have you told everybody how they can get a hold of the show yet this morning?
I don't have that on there.
You don't have that on that computer, okay. Well, you can go to YouTube, you can go to fetchernews.com, you can go to Twitter at FYNTV, and that's all I can remember. So anyway, I am RFG, I'm in for BKP. We had a nice little travel log segment here with Bill Whaley, the World Traveler. Now we're switching gears and we're going to Ask the Doc. This morning we've got a couple of questions and we're going to go to question number 1. You ready, sir?
I'm ready.
All righty. Is CBD or hemp oil or marijuana related products really a benefit to cancer patients? Excuse me. Someone recommended that we look into it to help my mother cope with cancer treatment, symptoms, side effects. What say you?
Well, I'm going to tell you, BKP was very ahead of his time.
Cutting edge, as we say.
Cutting edge. We're sitting in front of a store where a child had a intractable epilepsy problem years ago when we started this segment, and CBD oil was a effective treatment, and they couldn't get it. And I got a license from the state medical board to be able to prescribe CBD oil, and there were only about 6 of us in the state that could do it. So I've been in the CBD oil business since it started.
And when was that?
About 5-6 years ago.
Okay.
But 20 years ago, when they were studying Marinol, which is the drug for nausea, that's a prescription drug, I was part of that experimental group where it was Marinol versus smoked marijuana versus eaten marijuana versus placebo, and we were not.
Marinol was indicated for someone that was undergoing chemotherapy.
No, it was it was looking at everything, nausea, chemo, and it actually was marketed as an appetite stimulant for HIV patients.
Okay.
But it's still out there, and we use it in nausea for cancer patients. But the point I'm making was that marijuana was not magic. All right, it didn't do a lot better than anything else. And the enthusiasm for marijuana, for Marinol, has never taken over in the medical community, and we use very little of it, and we use it after we've exhausted everything else. So put up that first one there. The hemp oil issue, where it says hemp oil versus CBD oil versus, it's got about 10 different names, and they're all the same. And that video you got there, that slide you got there, shows a marijuana leaf on the one side and hemp seeds on the other. So pull that one down, and the question was asked specifically about cancer. So you got the pain ladder up there. I want to show you about the pain ladder, because the place that CBD oil is used most often in the community is I've got arthritic pain, or I've got this as part of it's called an adjunct to pain relief. And it has a place theoretically because it's been demonstrated to have an anti-inflammatory effect, particularly like, say, arthritis. So it is used as an adjunct in pain relief. We talk about the opioid epidemic, don't we? So this is the World Health Organization pain ladder. So when you've got pain, you're supposed to start down here at the bottom where the Tylenol, aspirin, Motrin, and non-steroidals are. But if you'll notice, it says plus or minus an adjuvant. Well, what's an adjuvant? An adjuvant might be if you got a sprain, heat, ice, and massage. But if it's other pain, an adjuvant might be hemp or CBD oil. It make sense to you?
Yep.
All right, so if that helped you here, it might prevent you having to move up to the next one, which is the opioids with codeine and tramadol and hydrocodone and so forth. And what does it say there? That's for mild to moderate pain. What does it say? Plus an adjuvant, or minus an adjuvant. So if you're talking about cancer pain, then the heat and the cold and massage wouldn't be the logic, because down here, but CBD oil added to that may help you not have to go to the next one, which is where you start getting in trouble. Morphine and the fentanyl and the rest. So we are
Schedule
really
2 drugs.
we are really happy to let people use hemp or CBD oil as an adjuvant to their pain relief, assuming they got it from a good place. Now let's go to that next one where that lady is taking that drop. Here's where some of the problems are. If you go online or you walk in a store right around here where they sell CBD oil,
let me tell you, that's all you see on billboards. You know, CBD here. Get your CBD.
Oh yeah, you can go to a drugstore or a 7-Eleven or anything now.
It just seems like it popped up all over the place overnight.
And we're going to come to that in a minute.
All right.
But you'll see something like this. Take 1 drop of CBD oil twice a day, and all your symptoms are going to go away. Down here it says baldness, go broke, so forth. But if you just look, ADHD, addiction, Alzheimer's, it's got 6 things with the A's, and this list goes way on down. So get off that lady with the drop there, and we'll get to this. Pretty picture of the marijuana leaf. And here is where the danger is. So here you are, you see this at the health food store, or like this patient family recommends you try some CBD oil, and you go online. And as soon as you go online and you start getting shoved to websites, we know what to say about Google searches, right?
Yep.
You'll find something like this that touts, this says cannabis, it'll be anything. And it'll tell you that it's going to help HIV and AIDS and diabetes. It can't help diabetes, menstrual cramps, fibromyalgia, everything else in the world. So,
well, how do they get away with that?
Because there's no regulation. It's like these vitamin supplements.
So the FDA is not involved.
No, it hasn't touched it. So go to that chart, to CBDOilUsers.com. Now this is interesting. This is an industry website. That you got to be an industry website. So if you got an industry website about transportation and it's run by the
DOT.
Let's say it's run by the Korean automobile dealers. They're going to have you a bunch of Kias and things up there, rather than Subarus and Volvos. So what this has done is it's broken down a bunch of different. All of these are CBD oil names, and they've made like they got different characteristics, so that if you got this one, it'd be insomnia, pain relief, and muscle spasms, and if you use this one, it'd be infectious and cancers. And this is all BS. Weight gain over here. I mean, stress and anxiety. That's a real one. Sleep aid, it may be good. Wound healing is not going to be good. All right. So put up the one that's got the body on it. This has got a bunch of different places. I'm not going to hit all of them, but we're going to go over this a little bit. Marijuana calms people down, right? I mean, the guy who sits back over there in the corner and smokes.
What's up, man?
Yeah. What's up, man? It smooths him out. Well, the second thing it does is you're supposed to you munch, right? You get the
blind munchies.
You get the munchies. So up here where it says relieves
anxiety. Not that I know anything about that.
No. Where it says it relieves anxiety, it is actually true that it may calm you down and assist you with anxiety and so forth. Second, we know, as I said earlier, that it has an anti-inflammatory character that can be measured. And that anti-inflammatory character may make it easier with some sort of rheumatoid or osteoarthritis. And it, as an adjunct to what your doctor's doing, not as a substitute, it may be beneficial. And then some of the other things that it's been touted for, I would say we should worry about. Well, at the end of this program, we always have a what's new in the medical news.
Are we going to move that to the
forefront?
Okay.
No, we're not. We're not moving to the forefront.
We're not going to change anything here.
No, we're not. Except that today in the medical news, we'll come to that. They got the vaping lung injury thing. We'll come back later. But so in the medical news yesterday, CBD oil used for chronic pain, opioid addiction, and inflammation, which is the highest number. So they got patients that had I can call them citizens, not patients or doctors, and they followed that group of patients and had them report on how they were doing. And as it turns out, when they started monitoring toxicity, there was a substantial amount of liver injury, liver function abnormality. There were various gastrointestinal and other issues, and a reason they tout for that is that there's no standard purity, no standard manufacturing, and this is not made by one of the big drug companies. They found in it nickel, tin, and THC. They had not had, the real marijuana, and so there were so many things in it that it was mostly the purity was the problem. What the source was the problem, and I think you're pretty stuck when you're at the 7-Eleven buying CBD oil. And if you're going to buy it, you probably ought to get it at a pharmacy.
So, okay, that was going to be my follow-up question. How does one that is in need, whether it be an adjuvant or whatever, how do they determine? Is it just the efficacy, distribution?
Yeah, it's this where'd it come from. And I think the only way you're going to have any sort of guarantee is you can't imagine CVS or some big national drug distributor sticking something out there they might get sued for because it's got crap in it. So they will have a lot better uniformity and purity and consistency of dose across each bottle. But you still
have no guarantees.
But you have no guarantees. There's no guarantee. But if I'm going to trust anybody, I'm going to trust them more than 7-Eleven or your gas stations. That makes sense?
It does. Thank you.
All right. So that's the end of that one.
That was question one. Question number one from for the doc. Now, let's talk about lupus. My oldest sister was recently diagnosed with lupus. She doesn't really want to talk about it. What is lupus, and how does this affect one's daily life?
This is a real important question, and I think a lot of my duty is to be honest about what we know and what we don't know. And I'm going to put my hands out like this because I do it to my patients all the time. And I'll say that rheumatoid arthritis, lupus, scleroderma, and these illnesses,
they all come out of the same family?
This is all the same family of autoantibody related illnesses, run the spectrum from absolutely no symptoms except you get up in the morning and you feel a little stiff. You never see a doctor for it. You never take a drug for it. To a life-threatening kidney failure, neurological disorder on the opposite end. And when somebody hears the word lupus, they immediately start thinking about the kidney failure and the neurological and the bad end over here. And of the cases of lupus, that bad end is going to be about 3%. And me and you waking up in the morning and stiff all over is going to be the large majority. So let's go to that one that we'll just throw this title one up and then get off of it. When you think about lupus, you got the picture now of the woman with the face? You got that up there? When you think about lupus, people think, my sister's got a facial skin rash, and many people, I'd say it's common knowledge among grandmothers, common knowledge, that if you get this butterfly rash on your face, that it can be associated with some sort of trouble, and they even can remember lupus. So this butterfly rash, and if you look at your face, you've been out in the sun, and you got a little red cheek here, your nose is a little red. Well, all of us look that way down here in the summertime when we're outside or we're on a boat. In the wintertime, when it's cold and windy, we look that way. So everybody with that thing hadn't got lupus. Now, the big side over here, real lupus can cause you to have fluid around your lung. It can cause you to have fluid around your heart. It can poison your kidneys. It can give you arthritis. It can give you all sorts of circulatory disorders. Well, there are lots of things that cause one of these or others, and so if you got a rash from standing out in the sun too much, and then they tell you that you're beginning to get kidney failure, well, you and I both got kidney failure because we're over 60 and our numbers are not too good. You don't panic on I've got lupus. So get the classification up there. We were not going to get too technical, but this says that the diagnosis of lupus requires the presence of 4 or more of 11 criteria. Well, only one is the positive blood test. Okay? Mm-hmm. So if you go into Atlanta Stadium when the Falcons are playing, there are going to be 78,000 people there if they're playing a good team. Of that 78,000 people, probably around 3 to 5%, if you do a blood test, will have either a positive rheumatoid factor or a positive anti-nuclear antibody. They aren't going to be sick in the least. So
that's just a statistic.
So frequently in a primary care doctor's office, when somebody says, my knee hurts and my shoulder hurts, and then they order an autoimmunity rheumatoid panel and they see the anti-nuclear antibodies positive, they will tell the patient, you've got a positive lupus antibody.
That doesn't mean they have lupus.
It does not mean they have lupus, and that very well may be what has happened to this older sister. She doesn't want to talk about it. She may not have anything. Now, the other things are a neurological disorder. I mean, many people with it are sensitive to the sun. I think before you heard me tell BKP, there are some people that could go out in the sun and lie like this and bake and love it. Most of us go out there and, we can tan, but it'll burn if we stay out too long. And then there are people who go out in the sun for 20 minutes and come back in and are red as a beet, and for 3 days have a fever and are sick. Okay, yeah. That's the photosensitivity.
Okay.
So far we've got a positive blood test, but you can be diagnosed with lupus without that blood test. So then you have photosensitivity, kidney failure, serositis means the fluid around the lung, disorders of your blood, immunologic, other stuff. So you've got to have 4.
What's a discoid rash?
That's a red circular rash on your skin, which a lot of people in our age group get.
Yeah.
It looks a little bit like that.
Like a bruise?
Yeah, sort of like a bruise.
Okay.
But that's pretty uncommon. But anyway, to make a diagnosis of lupus, you got to have all 4 of those things. Now let's get up the treatment one. Is it going to impact the quality of your life? Most of the patients that I have with a positive anti-nuclear antibody, it does not impact the quality of their life at all. And if the treatment for lupus, this is medical and not website, starts right off with, there is no cure for lupus. The goal of treatment is to ease symptoms. First thing, if you've got joint pain and stiffness, that's the Motrin business, right? If you've got a
first level on the pain ladder.
First level on the pain ladder. If you've got immune responses, it says corticosteroids. That's usually what you'd use for the short term. But you watch TV now and you watch Phil Mickelson and all that. Same drugs Phil Mickelson takes for that. You see those people that are taking the drugs for plaque psoriasis. All of those, that's immune modulating drugs. Have very little in the way of side effects. People are out there playing golf or playing with their kids in the pool.
Controls the symptoms, but it doesn't do anything for cure.
Correct. It does not change the genetics or change the immunity. It blocks the immunity.
Right.
And that's what they're talking about down here at the bottom about disease-modifying drugs. Now at the bottom they say talk to your doctor about diet and lifestyle habits. You can pull that off. But there's some things that if you've actually got a lupus, and most of the people with lupus, now if it's kidney failure, it's going to be the big drugs. If it's fluid in the lung, it's going to be the big drugs. But if it's the common thing of I'm aching all over and I'm sore, it is going to be, when you exercise with a steady dose if you're trying to get better, you go up by 3% or 4% a week. You don't go go into that exercise class with these girls.
They'd kill me.
Yeah, well, right, but they go 1 day a week for a few weeks. They say, I got to lose 10 pounds, and then they go 4 days a week for the next month, and they wonder why they've got a stress fracture.
Yeah,
or get a stress fracture. Right. So they would just change some of that sort of stuff. So to answer the question, you don't know for sure, but this question, does she have lupus or just a positive blood test? If she has lupus, is it this mild type that so many of us have, or is it way over there in the kidney failure end? So I hope you've learned enough there.
Got it, yeah.
But the most important thing here is that this patient with a positive blood test is in the hands of somebody with experience. That generally will be an internist or a rheumatologist. There.
The Ask the Doc segment is always brought to us by North Georgia Cancer Specialists, affiliated with Northside Hospital. We appreciate the time and the effort that Dr. Whaley puts in every week, and I'll go to the BKP route, and you always give us a little cutting edge.
All right, so we're way ahead of our time on this program. I think we were talking about vaping 5 years ago, or when we first started here.
I remember.
All right. We, about 4 or 5 months ago, talked about the legitimate use of vaping in adults with a long-term history of smoking, who have gone through the patches, they've gone through the gum, they've gone through the Chantix, they've gone through the group therapy like Weight Watchers, and are having no luck. And we've said, you are the patient that the Juul, which is a legit manufacturer, came out with a nicotine inhaler that would give you the nicotine without the adverse effects. And there is a pack, if you're smoking a pack a day, there's a dose you can use that's equal to a pack a day. And
so that replicates the nicotine intake.
And that's legit. Well, what happened next was all these fly-by-night manufacturers making it to look like a memory stick for a computer and all this other stuff, so kids could sneak it into the high school. And as we said here a few weeks ago, there was a bust here of a guy selling contaminated inhalers and people falling out in the school. Well, on June the 28th was the first report in the news about a serious acute lung disease in vaping. That was in the news. And in the next 8 weeks, which just ended yesterday, there have been between 150 and 300 reported, mostly teenagers, in the hospital, many of them on ventilators, for a severe pulmonary injury. Now, there are probably tens of thousands of people that haven't gotten that severe. This begins with coughing, shortness of breath, and fatigue in people. I think the youngest was 13. Then
all as a result of vaping.
All the result of vaping. And then what they find when they get into the doctor, they get them to the emergency room, is that they've got an inflammatory lung disease that I like to tell people would be a little bit like inhaling chlorine gas in the First World War, but it chemically is like popcorn lung. You remember popcorn lung from about 10 or 12 years ago?
I don't.
Okay, in a microwave popcorn factory in the United States, many of the workers ended up with a severe lung disease because of the
microwave?
No, the oil that they were putting in it. So, and that's when they learned that PAM and those sprays had stuff that would give you lung disease, and they changed the formulation, and kids were inhaling PAM. Remember that? So this is an inflammatory lung disease. You get into the hospital, and if you don't die, you're on a respirator and ventilator. It's treated with corticosteroids, like we talked about the lupus.
Right.
Then when you get off the ventilator, you got an emphysema or a chronic inflammatory lung disease, and nobody knows what the long-term effects of that are going to be. So what the CDC is looking at is no consistent manufacturer, no consistent product, meaning the guy had a strawberry inhaler or had a vanilla inhaler. But what some of the facts are is that in these nicotine pods that they sell, the dose in one nicotine pod of nicotine alone can equal the amount of nicotine in a pack of cigarettes. Well, a serious teenage vapor can use that pod in 15 minutes.
Wow.
Now, you couldn't smoke a pack of cigarettes in 15 minutes. So the intensity of the nicotine going into your lung in 15 minutes is kind of like a dose intensity of a guy that smokes a pack a day over 24 hours. So nobody knows how bad that's going to be, but that's one of the issues. And the other is that there are, again, all manner of contaminants in there because they don't know where it's making it. And just like in the CBD oil, nickel, tin, and metals are in there. And I think that has to do with the fact that when you make these oils, and that's what's oil that's in an inhaler oil that's not CBD oil, it's done in machinery, right? I mean, you got to make it in a machine and bottle it and stuff. So I think that's where the nickel and the tin come from. I'm not absolutely sure. Okay, the other thing I think that's worth mentioning that's in the news today is way back, back in the days we were worried about the Zika virus and the mosquitoes and everything.
I remember the days.
Okay, well now, all right, well you're hearing me do this, and the ragweed season's going to be horrible, and the ragweed season's just starting, and that's the only time of the year that I get this way, and that was in the news this morning. And I didn't get this till I sat down here outdoors.
Now I know what's going on with you and I sniffling this morning.
Okay, it's
ragweed.
It is, and we're outdoors.
Yep.
So I've been indoors all day yesterday working. I'm outdoors now. We're here in all this beauty, and I started doing this 5 minutes after we started. Okay, it's the ragweed season. So you go over to the you go to the dollar store or anywhere else and you buy that generic Claritin or that generic Zyrtec, start taking one now and take it for the next 60 blinking days.
Yeah, exactly. Always great information from
that was a dollar store.
Exactly. Always great information from Ask the Doc segment, brought to you by North Georgia Cancer Specialists, affiliated with Northside Hospital. We've got the all-star panel hovering to the right over there. They're getting ready to go. I can't wait to talk to Jane about some of the Russian escapades that you guys went through. Right. So, anyway, thank you for your time.
Hey, we got to sell some airtime here. Do a few commercials, all right?
Yeah, why don't you take us to break and we'll regroup?
We need to sell some airtime.